The key to proper management is to stabilize the patient by administering corticosteroids even if you do not have a confirmed diagnosis at your hand. We administer dexamethasone or hydrocortisone for 1 to 3 days in these patients. 0.9% sodium chloride is administered to overcome the hypotension in the patients of Addison's disease. We administer glucose to control the hypoglycemia. Eventually, you will consider oral glucocorticoid and mineralocorticoid replacement therapy for a lifelong treatment. Patients need to be annually checked to ensure their glucocorticoid and mineralocorticoid levels are within the suitable ranges, as high levels can lead to hypertension as well as edema in these patients. Secondary Cushing syndrome can also occur in these patients with over-replacement of the hormones. Dosages needs to be adjusted in these particular cases. Long-term usage of replacement can lead to bone disorders such as osteopenia or osteoporosis. Patients diagnosed with Addison's disease needs to carry a medical alert with them to warn others about this condition in case they experience a medical emergency. An Addisonian crisis occurs either because of undiagnosed Addison's disease or for those patients where there is a presence of acute stressors like underlying infections, trauma, or severe illness. This requires emergency medical treatment with replacement of fluid and corticosteroids, as it can be life-threatening. 1 liter of 0.9% sodium chloride is administered quickly, and then further fluids are to be given over 24 hours of at least 2 liters to 4 liters. The underlying cause needs to be investigated and treated as well. Patients with an Addisonian crisis will experience symptoms of sudden pain in their legs, abdomen, and back, and severe diarrhea and vomiting. They will have severely low blood pressures, hypoglycemia, hyponatremia, hyperkalemia, confusion, fever, and convulsions, and they can also lose consciousness at that moment. It is especially important not to delay the treatment at any cost. Now you all must be well versed with this condition of Addison's disease. Keep watching sqadia.com for more detailed lectures on medical conditions.